Good morning, good afternoon, Dumelang, Sanibonani. Welcome to the series on the state of data science in Africa, hosted by the National Institutes of Health Common Fund. My name is Pila Makhwadibe, and I'm here with my colleagues from No Innovation. We are a facilitation team that specializes in accelerating scientific innovation, and we are very glad to be here supporting this virtual event today. And I would like to give you an overview of our agenda today, and I'm going to share a slide. So today we'll have very briefly welcome remarks and tips for engaging in this webinar. I will do that, and then we'll have an overview of today's session on data science and environmental health from our moderator, Gwen, Collman. Then we'll have about 10 to 12 minutes presentations from each of our panelists, followed by the questions answered by the panelists, and then we'll have a plenary conclusion. After all of this, we will have an interactive networking session that is optional. It's an opt-in, so we do hope that you will choose to join. It starts after the webinar is finished, and this is where you can continue to interact with the panelists and dive deeper and network with each other who are interested in the topic of environmental health and data science in Africa. Now, today's event is associated with the new NIH program on harnessing data science for health discovery and innovation in Africa. There are 4 different funding opportunities currently open. There they are on the screen. They are open for application, and you can learn more on the website that is displayed on the screen. Applications are due to start in late November, and you are encouraged to visit the Custom platform to learn more about applying NIH grants and also to meet and network with potential collaborators. So please take note of the website and also take note of the application receipt dates between the 24th of November and the 8th of December. What else? Social media. If you are on social media, you tweet, you're on LinkedIn, you write articles, please use the following hashtags on various social media platforms, and would like you to note them down: DSI Africa, NIH Africa Data, and No Innovation. Thank you. I'll stop share, and before I hand over to our moderator today, I would like to start with a few tips to optimize your experience in the Zoom environment. So we are recording this session, and if you want to review the video later, you will find it on Storm and on the NIH YouTube channel. In both cases, captions will be added. If you have technical questions or issues, or get lost or bumped out of Zoom at any moment, you can always scroll down to the Storm menu to the Need Help page, and we'll help you sort it out. You are invited to add questions for the panelists during the session. Use the Q&A button at the bottom of your screen to ask questions to the panel. You may answer some right away in writing, and others we may hold to answer specifically during the Q&A session. And if you see a question that you really appreciate or that resonates with you, you can give it a thumbs up and endorse it as a worthy question. We are a very large group here today, and I don't think we can possibly answer all the questions, but we will do our best. With that, I would like to introduce today's panel moderator, the wonderful Gwen Collman. She is the Acting Deputy Director at the National Institute of Environmental Health Sciences. Over to you, Gwen Collman. Thank you.
So today's webinar is entitled Leveraging Data Science Approaches to Address Environmental Health Challenges in Africa. And as you can tell from the title, the goal of our session today is introducing all of you to the variety of different types of data that are collected across all kinds of research and policy applications in the field of environmental health. As you'll see from the speakers' examples today, the types of data available for use in our field is varied, it's voluminous, and it is varied. We have data that is collected at many, many levels, and we'll go through some of that information and show you some about that. This slide here is a depictor of the complexities of environmental health data. It's quite complicated to document a person's exposure to a variety of environmental exposures, and each of the types of data represent either the source, the class of compound, the type of exposure, the places from which people are exposed, and also the timing over one's lifetime for when they were exposed. So as we work in this field, we see data coming from a monitoring environment, getting samples from air, water, soil, either directly or through sensors, personal biomonitoring of environmental chemicals or other exposures that are analyzed using analytic chemistry techniques. Even molecular level markers of our exposure are often combined with geospatial and temporal aspects of data, either coming from satellites or coming from continuous monitoring at various sources. In addition to exposure data, our research community uses a variety of health data to be able to look for associations between exposures and health. And our investigators are actively using data on morbidity and mortality from many, many health outcomes. They often have access to personally recorded data, either through questionnaire surveys or new sources like cell phone acquired data through a variety of new apps that are being developed. So one of the major challenges of our field is integrating all these streams of data in ways that we can usefully depict somebody's exposure over their lifetime. And that field is known as exposomics. And the reality of the data that's involved in our exposome concept is that there's legacy data, there's real-time data, there's data over the lifespan of the person, and there is just lots and lots and lots of complicated data to make use of, both for testing hypotheses as well as developing new hypotheses about the relationship between exposure and our health. And so I'm very pleased to say today that we have three distinguished speakers with us who have a lot of experience in handling lots of different types of research studies, and also have worked in the policy implications of using that data for the good of our society. Our speakers are Dr. Kiros Burhani from the Mailman School of Public Health at Columbia University in New York City in the US. Dr. Engineer Beno Muchgisha from Makerere University in Kampala, Uganda. And Dr. Cara D. Wright, from the South African Medical Research Council at University of Pretoria in South Africa. Each of our speakers will speak for give us a presentation for about 12 minutes. We suggest that you use the Q&A feature in the Zoom room to ask questions. We were happy to take any clarifying questions during the presentation. If there's an acronym you don't understand or a simple concept, the speakers may be able to type back an answer so that you will be able to understand what you're hearing, or they will be able to respond quickly after they're finished. We ask that all of the larger questions, the more complicated questions and discussion, be held for the end after all three speakers have completed. And as Pulang said, you'll be invited to join us in the networking room after we're done for more personal interaction with both the speakers and the members of the audience, so you can share ideas, make collaborations, make new introductions based on your own interest areas in this field. So let's get started. Our first speaker this morning is Dr. Kiros Burhani. Dr. Burhani is the Cynthia and Robert Citron, Rosalind and Leslie Goldstein Professor and Chairman of the Department of Biostatistics at the Mailman School of Public Health, Columbia University. He is from Ethiopia, and he received his bachelor's degree at the University of Addis Ababa, a master's in statistics from University Guelph in Canada, and a PhD in biostatistics from University of Toronto. He completed a postdoctoral fellowship at Johns Hopkins University in the US. Kiros is a widely published international expert on the development of statistical methods with focus on complex and correlated data structures, as well as their application in a wide range of public health topics, with a special interest and focus on environmental health. Currently, as chair at the Mailman School of Public Health, he is promoting and developing public health data science research and educational programs, and they've developed a new track in public health data science, and they're refocusing the MPH program towards public health data science. His own research increasingly involves machine learning techniques as the complexity and volume in data increase in environmental exposure and health research applications. Welcome, Kiros.
Thank you very much, Gwen, for that wonderful introduction. All right, so in my talk, I'm going to talk about environmental health research, data science in Africa, three my really favorite topics. And my presentation is going to be divided into three main parts. First, I'll try to establish some definitions to the extent that we can, simply because this is an evolving field. I'll talk about some guiding principles, and then I'll describe some of the major environmental challenges in Africa that Gwen has already alluded to. And then I'm going to follow up with new opportunities to collect big data in the realm of exposure and health and the complexity of that kind of data. And then finally, the role of data science in addressing this environmental challenge. I'll give some examples. I'll talk a little bit about capacity building issues, ethical considerations, and some cautionary notes and challenge and pitfalls. So starting with definitions, what's really data science? A very simple definition that Jeanette Wing, who is the director of the Columbia Data Science Institute, gave was, data science is simply the study of extracting value from data. And here you can define extracting value in any different form you like, and you can define data in any form that you like. And in fact, she has a blog at datasciencecolumbia.edu that says, what's data science, which actually goes into the philosophical underpinnings of this simple definition. If we go to Africa, there is an article by Wim Dilva from South Africa that actually defines it as relatively new interdisciplinary field, which is a blend of statistics, computer science, mathematics, engineering, and any subject matter knowledge. And we will back to what we mean by this in environmental health. And of course, there was a good review paper by Choirat et al. That also gives kind of slightly different but very comparable definition. But if you really want to be cynical and really be maybe pragmatic, there is this very astute observation that was posted by Daniela Witten, which says, when we raise money, it's artificial intelligence. When we hire, it's machine learning. And when we do the work, it's logistic regression. So are we really talking about the same techniques but are being repackaged? I think the answer is a little bit more complicated than that, because there are many, many new tools that are coming from the fusion of the different fields that has really advanced our field and are shaping the way we do science. So if you want to focus it into public health and environmental health, all we have to do is simply kind of focus the definition into what we mean by public health data science or environmental health data science. All right. So again, data science techniques come in many different forms. I'm not going to go into technical details about this, but one of the most important segments of data science or machine learning is what we call the supervised learning paradigm, where we're really talking about building models for prediction based on input features. And here we're using this to select useful features and contrast this to the way we have been doing traditional biostatistics and epidemiology, where we are actually guided by very conceptual framework where we have much fewer features and much smaller data sets. So in supervised learning, you're really talking about having training data, trying to come up a learning algorithm, and then finally to have a model that would give us the best prediction possible. And we can have different flavors about this, where we have like very small sample size, but large number of parameters, what we call wide data. We have techniques like the lasso or elastic net or many others that we can go into detail in question and answer. And these are prone to overfitting. They have too many variables, too many features. And for instance, lasso fits linear models that are sparse in variables. So they give interpretable results, but may miss interactions. And when we have data structures that have very large sample size, but relatively smaller p, but still big in compared to traditional sense, which we call total data, then we have a different set of models that would actually allow us to fit nonlinear models with interactions, where simple linear models in this case may not be sufficient. And then of course we have techniques like neural networks that actually fit flexible nonlinear models. They use all available features, but they're hard to interpret because they have hidden layers that may not be amenable to health effects research. So the black box nature of machine learning algorithms might be problematic in health-related research. And of course, when we're talking about health effects modeling, we need to have some sort of way of quantifying uncertainty in the predictions so that we can actually give enough level of precision to the data that we're getting from our techniques. So let me walk you through kind of the conceptual framework in terms of how our fields have been evolving. And I'm going to take the talk from statistics all the way to data science because that's how I come into this field. So traditionally, as you know, statistics has been a well-established field. Of course, biostatistics is a very important branch of this simply by way of fusion of biomedical sciences and statistics. And then, over time, actually starting from biostatistics, where really the issue is about, maximizing signal comparative to noise. And there is a century or even longer, history of having careful study design, careful estimation, testing procedures, very rigorous theory that actually has, anchored how we do science in a very principled and well-established and well-developed techniques. But then, of course, over the last, decade or so, and increasingly so, we have been, swimming in big data through GIS or mHealth or sensors or many types of omics, exposomics being the most important part for our topic today that Gwen actually already talked about. And then the issue is, of course, how do we deal with all this deluge of data, which is really a blessing, but at the same time a curse if we don't use it carefully, is this whole slew of techniques that are coming from computer science and infusion between computer science, mathematics, informatics, and so on and so forth. We have neural networks, machine learning, artificial intelligence, prediction, and so on and so forth. And really now we're talking about data science, where biostatistics could be a sub-part or maybe a distinct part of it. And we really would like to have noise versus signal focus because we're talking about biomedical hypotheses. And of course, over time, the hope is that actually there will be an interaction, a loop that actually will feed, taking the best practices from concepts in biostatistics, but also techniques from machine learning and other computer science-based methods. So hopefully we'll end up with something much better than what we started with and what we're evolving towards. So the major environmental challenge in Africa, again, Gwen have already talked about it. The challenges are complex and multidimensional. And of course, we know that Africa has already been facing other multiple challenges other than environmental health, malnutrition, poverty, infectious disease, vector-borne pathogens, threat of NCDs that are really emerging. But of course, we also have a wide range of exposures on the environmental side, including outdoor and indoor air pollution, electronic waste, heavy metals, pesticide, and so on and so forth. And of course, we also have rapid urbanization, population growth, and rapid industrialization. And the increasing recognition that the burden of disease from environmental and occupational hazards is actually growing. And WHO's burden of disease work has really crystallized this in making people aware of how important this issue is. And of course, we have the ever-looming and growing health consequence of climate change. But in face of all this, we also have lack of high-quality data, but also limited human capacity and limited infrastructure in key areas. So we need to address this in order to handle or address all these environmental challenges. So what are the new opportunities to collect big data in Africa? Of course, there is new affordable technology, which is leading to massive data bonanza, which, as I said, is a blessing and a curse. from wearable devices, from low-cost sensors, from personal exposures that have GIS stamps in very high temporal and spatial resolution. You have satellite data coming and remote sensing of any type. And of course, Africa is coming into the mix, as I'll show you shortly. The ability to combine and analyze data from disparate sources. And here, what my keynote speaker in one of our public health data science summits in Colombia, Rob Tipshirani, actually called data siloing, which is really this reluctance to share data. And those of you joining from Africa know exactly what I'm talking about. Data sharing, data transparency is actually very important, but it's not a norm in the African setting. And of course, the move towards electronic records for health data might give new opportunities in order to deal with these issues. So I'll give 2 or 3 brief examples. The first one is from the Eastern Africa GeoHealth Hub that I'm actually co-leading, that has activities in Ethiopia, Kenya, Uganda, and Africa, and Rwanda. And this is actually an example where machine learning techniques do not necessarily need to have big data. Here, actually, the team in Ethiopia, and courtesy of Yosef Getachew from the data team, actually tried to come up with machine learning techniques in order to deal with some very, very strong challenge in dealing with environmental data. So in the GeoHealth Hub for Eastern Africa, data are being collected on daily mortality and morbidity and pollution on PM2.5 using continuous monitoring. But the daily mortality and morbidity data are not fully electronic. So there is a huge manual element that actually has led to massive data cleaning and ICD-10 based classification that required like more than 500,000 and growing number of records that potentially needs to have cleaned and classified manually, which almost is an impossible task. So the team actually came up with a machine learning approach. It's called WEKA, or Waikato Environment for Knowledge Analysis. And they try to use this technique in order to minimize the process of cleaning data. So this actually is just briefly to give you an example of how machine learning techniques and data science techniques could actually be helpful even in a non-big data setting. The other types of data that are coming into the African setting is actually from satellite data. This is actually from the soon-to-be launched Maya satellite, the multi-angle imager for aerosols. And the primary objective is to link exposure to different types of PM with human health, and with focus on many different types of health effects, and of course to characterize PM, to collect many types of data. But why I'm actually flashing this is actually there will be many countries, especially South Africa and Ethiopia, are primary targets where data on health and data on exposure is being collected, and therefore, when this data become available, in fact, I think there will be an opportunity to use machine learning techniques. Now, another example from the GeoHealth Hub in India is actually where they try to use lots of data sources in order to come up with an ensemble modeling technique in order to assess spatiotemporal variations in ambient PM2.5. Now, if you look at the boxes in the data types, you have ground monitoring, satellite data, climatry analysis, land use. All this could actually be high dimensional. And of course, the main engine for this one is the ensemble technique. So if and when we have data in the African setting, then readiness in data science actually is going to be very important. So data science in environmental health research, just to iterate key points, it's ideal for high dimensional data, but it's most useful when informed by relevant scientific principles, whether we're using available data or designing new studies to collect or analyze primary data. There is a balance needed between prediction accuracy and inferential goals, and to minimize the black box nature for interpretability. You need to pay attention to bias, measurement error, and quantification of uncertainty, which is very crucial. For instance, in health effects analysis based on modeled exposures, data quality on both health and exposure needs particular attention. And we need to actually pay attention to informative missingness and systematic data gaps, especially even more so in the African setting, because data gaps are actually crucial, especially when you go back historically. So some notes of caution: more data does not necessarily mean better signal. Okay, so that's actually something that we need to take as a take-home message. In fact, better study design could lead to better signal versus noise. So we need to use our accumulated knowledge on study design and statistical principles into the fore. Some concepts are more important than others in the big data setting. Bias actually becomes a much bigger concern than precision, especially when you have huge amount of data where statistical significance does not mean much. Training of data scientists with attention to unique African context is very crucial. I don't have time to go through details on this, but we can come back to this later. It's important to close the skill gap as soon as possible, and smart strategy is needed in prioritizing training needs. Investment is needed to enhance computational power, but also efficiency. But finally, and not least importantly, ethical considerations are crucial. We have to have responsible use of data. We need to have what we call algorithmic fairness. In other words, we need to worry about bias against subpopulations, especially vulnerable populations. We need to pay attention to primary issues, to privacy issues. We need to pay attention to social justice. We need to pay attention to disparity issues as well. Okay, so with that, I'm going to stop my presentation. And if there is any time, I'd be happy to answer any questions. And finally, a plug that in January 15, actually, there was a very interesting public health data science summit at Columbia, where I can actually share the link for that. All these issues were discussed, obviously in a global and the US setting, but they are very, very important and timely and relevant to the discussion that we're having today. So I would like to invite you to actually watch the video, which is online. Thank you.
So Dr. Engineer Bino Mugisha is an associate professor and chair of the computer science department at Makerere University in Kampala, Uganda. Engineer holds a PhD in computer science from Vrije Universiteit in Brussels, Belgium, and he's specialized in mobile computing, programming languages, distributed systems, context-aware systems. His research focus is on computer science-driven solutions to prevailing world challenges. Currently, he leads several innovative and research initiatives that aim to create and apply computational methods and tools that can improve the quality of life, especially in the developing world setting. Today, I want to let you know that he is the project lead of AirQO, a research initiative that develops and deploys low-cost air quality monitors and uses machine learning and data science tools to derive patterns and actionable insights to inform actions to improve air quality in urban towns and cities. And I'm going to turn it over to you, engineer. Welcome.
Thank you so much, Gwen, for that introduction. Good afternoon, good evening, everyone. I'm here to talk about how we are leveraging data science and other technological approaches to environmental health challenges in Africa. Specifically, I will talk about our experience from the AirQO project. AirQO, which is a research initiative that's a collaborative with Google and Makerere University on developing low-cost air quality monitors and also applying data science approaches to derive insights from this data set. So in a nutshell, the AirQO project, we start from, the data collection, so building the tools to collect the data, up to, creating insights using data science approaches that can inform, actionable actions for either at the individual level or the stakeholders like the city governments. When we started out, and as you know, anyone who has done data science research on the African continent, one of the biggest challenges is access to data. And in many times, as an AI researcher or data science researcher, you have to build what you call an end-to-end, data system. You have to build the hardware that actually collects the data, especially for the environmental health challenges, and before applying the data science tool. So when we started out this work, we had interest in available data sets on our air quality, but we didn't have much available data set, and that inspired us to start creating our hardware that could enable us to collect air pollution data. And what's interesting is that the process of creating these data collection systems also uncovers a lot of underlying challenges that you probably cannot see in many other contexts, as I will talk about later on. So in brief, we have about 80 air core monitors that are deployed in Kampala city and also across Uganda, 40 of them in Kampala and the other 40 outside Kampala. Kampala is the main city in Uganda. And we get about 75,000 measurements per day across the network. And we accumulated about 30 million records of air quality data per year. We also have been exploring innovative ways on how we can collect this data. Again, exploring what's available locally and trying to build data collection tools that fit within the local context. And in the picture there is an example of one of our devices that is mounted on a motorbike, what you call border borders in Kampala, which gives us, a possibility to collect data at a higher resolution from many places that we cannot reach with our fixed sensors. So a little bit of motivation on why this challenge is important has already been motivated by Kairos from the previous talk. There's a huge data gap, especially when it comes to air pollution across the African continent. As you can see in that map, in terms of publicly available air quality monitors, you can see that Africa is under monitored, and this is true for air, but it's also true for many other environmental factors. And if you zoom in here, you see that there's an activity happening in some parts of the continent, especially in the southern part of the continent, but little activity in the other parts of the continent. So this really motivated our work in that if we really want to tackle an environmental health challenge like air pollution, then a starting point, even before we think about data science methods, is that we need to be able to measure and quantify it. And this is a highlight of our network so far, the aircore network across Kampala. As you can see, we have monitors highly concentrated in the major urban areas, Kampala and the surrounding areas. But we also have been able to deploy some of these monitors in as far as the border between Uganda and Congo, Kenya and Rwanda. And of course, what is challenging in all this is, how do you actually operate a real-time air quality monitoring across the country? There are so many issues that you have to deal with. But also there's a lot of available technology that you can leverage on. We know that there's a wide availability of cellular connectivity, for instance, but we also know that, we cannot have power access everywhere. So some of these issues have informed the design of the, air core monitors. So building monitors that can be powered and can send data of available cellular technology, but can also be powered, using solar technology for places where we do not necessarily have access to, power, or we don't have access to internet connectivity. So once we get the data, then we are also doing work on, making sense out of this data. So we're building custom platforms to enable data analysis and also inform awareness and actions through partnerships with the regulators. And most importantly, also, we are working with the communities, people like the border riders, the schools are hosting our monitors, members of the community in different parts of the country, they are hosting our monitors on their premises. So this has also given us an opportunity to tackle an environmental health challenge while working with the communities to be part of the solution. And by working with the communities, we're also able to raise their awareness about air quality issues and also the implications of poor air quality. So this is just an example of how this work and how if you're able to create insights from this kind of data, can be used by, policymakers like the city government. In this particular case, we're building a custom dashboard for Kampala Capital City Authority, which is the city government responsible for managing the city. And this dashboard gives them the ability to see the pollution variations across the city. And this is informing, decisions they can take in terms of at least understanding the variation of, air pollution across the city, but also trying to understand, which divisions, which parts of the city might need more attention. We also do have, public targeted mobile app, which can, be used by individuals to track, the pollution levels in, the places of interest. So as you can see in the picture there, we do map out, analyze. So this data comes in real time every 90 seconds. Data comes in, is aggregated, is averaged at acceptable intervals, and then we also map this on the World Health Organization targets standards, which in this case for particulate matter 2.5 requires PM 2.5 to be within 25 micrograms per cubic meter for the 24-hour period. We also been working closely in terms of using the insights we're getting from the network, having this data for a long time, being able to create some insight that can actually inform the national air quality standards, which are not in place at the moment, but we are supporting the National Environmental Authority to establish the national air quality standards. And our data across the country has been helpful to inform the status on what is possible, but also being able to understand what are the reasonable targets that can be put in the national air quality standards. So this is ongoing work, and we hope that going forward as we deep more insights from the work, we'll be able to inform and provide evidence to inform the policy decisions in terms of managing air quality issues in Kampala, but also hopefully in other African cities once we get an opportunity to scale out. Just a few examples of some of the other data insights that we're able to derive from these data sets. So for instance, we're able to see how is the variation of air quality across the year, and also how does this compare. For instance, we see that Kampala on average the pollution is higher than other places, which obviously also pinpoints that maybe if we need to drive actions, we might need to focus on some of the major cities. But also we're able to see the possible meteorology effects across the year as we track the pollution from January up to December. Another example of a simple data story that we're able to derive from this data collected over time is we're able to see how the pollution is varying across the major roads versus the non-major roads, and as expected, we can see that air quality tends to get worse around the major roads. But also what is interesting is that regardless of the location, you have a similar pattern of air pollution variations across the day. So air pollution getting worse early in the morning and late in the evening, and improving from around 10 a.m. To 3 p.m. Which is informing discussions on what are the likely causes in the space. Is it the meteorological effects, or is it actually the the pollution drivers in the area? And what we found is that working with the stakeholders and the city governments is that to start with, you do not need a sophisticated machine learning or data science model. You want to start off with a simple insight from the data that can then be able to inform further discussions and questions. So this has been interesting for us in that once we have the data, we don't go into the most sophisticated machine learning models, but starting with the simple insights, and the stakeholders are able to ask more questions and lead into other machine learning problems and questions. This is another example of a data story. So having access to data that's already available at the Uganda Bureau of Statistics, so we can actually be able to map out how does the pollution vary by the places that use more charcoal or biomass for household energy, cooking and so on, versus areas that are known to have high density of waste burning. And we can clearly see that there is a a realization that areas that certainly have practiced more cleaner energy, they seem to be in a cluster of fairly cleaner air. But this is worth further investigation. Again, this is meant to probe and interest our stakeholders into the kind of questions they would like to answer with available data set.
We'll need to wrap
yeah, so
up
as
now.
I come to the conclusion, just a few insights from what we get here is that whereas the traditional AI research would normally try to focus on having a model that works well, when you are working in data science that impacts on community, you need to look at the extra stage, which is deployment and feedback. Thank you so much, and happy to take any other questions. And for any interactions, you can be reached on the emails provided there and social media information. Thank you.
Thank you so much, engineer. A very informative and innovative approach. And I know it's being taken up by many citizens as well as government officials in your area. There was just one clarifying question in the Q&A, and could you please just let everybody know what the unit of measurement for the air pollution measurements are so that they can fully understand the data that you showed?
Yeah, that's micrograms per cubic meter.
Okay, thank you very much. So our last speaker for today's webinar is Dr. Karadi Wright. She's a senior specialist scientist at the South African Medical Research Council, leading the Climate and Health Research Program. She holds a PhD in public health from the University of Otago and also has training in geography and environmental management from the University of Natal. She is an adjunct lecturer at the University of Pretoria, a research associate at the Nelson Mandela Metropolitan University, and a senior research associate at the University of Johannesburg. Her research focuses on many aspects of environmental health. She's published many articles in the field of climate health, as well as other environmental exposures and health outcomes. She's a committee member of the WHO Air Quality Guidelines Committee, council member of the American Society of Photobiology, an intergovernmental panel on climate change assessment, Report 6, Africa chapter author, and a member of the writing team for UNEP's synthesis reports. She also has been part of the Lancet Commission on WASH 2020. So with that, I'll turn it over. We look forward to hearing your remarks, Dr. Wright.
Thank you very much. Thank you so much for the opportunity to speak today. I'd like to hone in on some examples using what we've learned already from the previous two speakers and making it more understandable in an African context through some of the work that we've been doing in South Africa. So to start off with, there's always the question we hear in environmental health, which is ultimately around prevention. Why is it that we treat people who are sick only to send them back to the homes or workplaces where the environmental risks and exposures occur that make them sick or exacerbate those diseases? And essentially, what we want to do is build up data that we can translate into evidence that will then stimulate action. And that's what most of the projects that we undertake collaboratively with different organizations around the world at the MRC aim to achieve, ultimately to serve society globally. So I'd like to use 3 examples today to illustrate how we can make data meaningful to different audiences to create the evidence for action, decision making, and policy making. The first lot is around the data itself. I'm going to look at 3 different studies. The first is around infectious disease and climate change. Then we've got one around air quality and health. And then the last one is around heat and health. And the data for all of those comes from different sources. The challenges is how to take the data from the different sources and put them together. And I already saw in one of the Q&A questions that there was a question about, well, what do we do about qualitative data, which we are using more and more in our studies today? And ultimately, we want to take that one step further and not just provide a decision maker or a policy maker with a bunch of graphs. We want to give them a bunch of recommendations that are soundly based on evidence. And that's where we try to take our research through research translation and research communication. So the first example is an infectious disease early warning system where we were involved. It was for malaria, diarrheal disease, and pneumonia, and we were specifically involved with the diarrheal disease. This was taking place in the northern parts of South Africa. So we always like to identify where we are working, the climate and the meteorological context in which we work. So we'll do quite a lot of GIS work to bring together the different data sets and layers, as well as looking at the socioeconomic data that might be available from our census. But in this instance, we really wanted to understand, besides what was reported at provincial level, we wanted to hone in. And the only way to access hospital data or clinic data, as has already been discussed before, is to go and visit those hospitals and clinics. There is an example here with tiny little spider writing and tiny little lines, handwritten records that we scanned manually and then entered into a database to become electronic, so that we could have daily records of every disease encountered at these hospitals, admissions at least. What were we trying to do? Well, in the case of diarrheal disease, we looked at the high and low weekly diarrhea case count anomalies in children under 5, and we compared that to both rainfall and temperature data. We know that temperature data is usually more robust than rainfall, particularly when it comes to model data, but we were looking at observed data from the nearest monitoring station. And essentially the outcomes here, when you want to translate it into action, were 2 things. Primarily the early warning system, which has now become part of a bureau, which is putting out quarterly bulletins on what the predictions will be or projections will be for the upcoming seasons. But what was more important is the little bits at the bottom that appear there. The value of hospital and clinic records for climate research. Some of the things that we encountered: missing books, loose papers, handwriting you can't recognize, and that we really encourage hospitals to go digital to secure their storage and retain records forever. The second study is an air quality and health study. Again, we always want to understand where this is situated in our country, so we would hone in and look at all the GIS available data for the areas. We were very interested in domestic solid fuel burning in this study, and it's a multi-component study. Ultimately, it was a randomized controlled trial intervention-based study in 2 studies with an intervention and a control. And if you have a look, you'll see that there are a number of data streams, including household assessments, environmental assessments, health assessments, taking place in both of these sites. You can imagine that when you're collecting air quality data, temperature data, household observation data, health data, spirometry data, you've got a lot of data to manage. And the field work for these different components of the study are extremely complex and time consuming and costly. But essentially, we're wanting to merge that all into one overarching data set. And how we did that in the next slide, and first I'll show you what we did to try and convey some of the original findings from our baseline, was to use infographics. So here we've got infographics that speak to energy stacking that takes place. In other words, people switch between fuels. What are our ambient air quality standards? Are they being exceeded in these areas? We looked at self-reported results from the questionnaires, and that coal stoves are really the main source of air pollution in the study. What are the respiratory outcomes? We're really trying to just provide snippets to our funder from our baseline data collection. And we usually try and provide that in very simple bite-sized pieces of information. But how did we connect all that data together, particularly when we were in the field? And in this instance, we used a QR code as our unique identifier. So each household actually had a QR code on their door that we could then scan when we were using electronic data tools or different instruments to make sure that we were linking the same data to the correct household. It did also require intense working with a data manager within our organization, because this is the largest data set that we'd ever collected in the field, and we wanted to be able to combine it in a very organized manner. And essentially, by using tablets and not paper, we could be digital from the start, and it allowed immediate cross-checking because data was live streamed as it was captured. And the last study I'd like to talk about is around heat health early warning systems. So this really was prompted by government saying to us, we want to put out information for people when it's hot. We want to give them more information than just this is what the temperature is going to be, or that we have a heat wave coming. Can we co-develop materials that can be distributed not only by the Department of Health, but to the Department of Basic Education? So here's an example of a poster that we made that illustrates different ways to cope when it's very hot. The data that has been collected retrospectively from observed records in South Africa indicates increased warming in South Africa, and so do the projections from the various models. And this then led us to consider the need for a evidence-based, health-based heat health early warning system for our country. This means that we're looking at exposure and outcome data. In this case, we were using daily mortality data records for a period of 20 years for all of South Africa's district municipalities, and then daily diurnal temperature range, which was the main indicator that was relevant for as many of the districts as possible. We then came up with a definition of a heat wave event and the various warning criteria that would be used. And in this case, the one that was most significant is daily DTR, or diurnal temperature range, the difference between the maximum and the minimum. And that was found to be about 12 to 13 degrees Celsius nationally. It's more specific at different levels. And when that is triggered based on projected or on forecast data, we'd be able to issue a more relevant health-based, in this case, mortality-based warning. So this definition is now based on high temperature and a health outcome instead of a number that has been made based on the average of warm temperatures in an area suddenly exceeding that average. We found, as I said, mortality with diurnal temperature range was the one that should be used to create heat alerts using these forecasted temperatures that we have done by our South African Weather Service. And we can use these data to inform and issue heat warnings and impacts, as well as thinking about interventions and a targeted response, especially by honing in on areas at excessive heat risk. So here we have the results. So here we've got the data that's been processed to look at heat wave events in the nine provinces of South Africa using the national threshold that we've come up with, the diurnal temperature range of around 12 degrees, and it's over that period of years. And essentially what we're seeing is when the total number of heat wave days would be present through the different seasons in each month of the years. And then when we look at this spatially distributed, the number of days in each of our 52 districts across South Africa, we can see that there might need to be some tweaking of that diurnal temperature range specific to a district municipality to ensure we protect health in those municipalities. And this is all speaking to what was requested by our national department for the new National Heat Health Guidelines, as well as our second Climate Change and Health Adaptation Plan. And essentially, we'd like to work together with others in collaboration to make operationalization of such forecasting. So in conclusion, we really need to think about how to make data meaningful. And it's those 3 steps from data to evidence to action. We need to go digital. We need data sharing, and that really needs to be encouraged. It was mentioned before. We need data managers to be included from the beginning in our planning stages of any of our public health or environmental health projects to maximize our output. And the 3 golden things that I'd like to leave you with here, and there's a lot of words, but essentially relationship with data managers are key. Simply collecting the data is not enough, it's the first step. Researchers are not always excellent at research translation, so we need training in that, and we should work with science communicators. And lastly, we have to make information relatable. Not only are we taking data from people, but we need to take it full circle to bring the findings back to people to make a difference in people's lives and essentially prevent ill health. Thank you.
Thank you so much for that excellent talk. It's great to see the different case studies of research and understand how important that data are in making informed decisions. And a shout out to the need for workforce training, both in data science and science communication. So we have finished with our 3 excellent presentations, and we are going to be able to go to our Q&A. So our first question this morning is from Eric Coker, and he asks Dr. Burhani, although I think this is quite relevant to all of our speakers, can you speak towards the value of cross collaborations for different regions, East and West Africa, to ensure data harmonization to facilitate integration of data science approaches across the continent?
Okay.
Kiros, do you want to start?
Yeah, thank you. Yeah, thanks for that great question. There was actually also a related question lower down from TM on similar theme. So I think, obviously, I think you need to have some standardization of definitions and make sure that, the data are comparable and combinable, if I may say so. But at the end of the day, you have to stay true to the data. So I think it's not really East and West, but even within a given country across different, data sources, I think in order to make use of the machine learning and data science techniques, you need to have data that could be combined across many platforms, many data types, and many different definitions as well. So, and there are techniques, for, addressing this issue. And there are also precedents and role models that we can follow. For instance, in the US, the ECHO consortium that's run by NIEHS actually has been combining cohorts from many different institutions that were collected for completely different purposes. But there is a set mechanism for actually trying to harmonize it through a coordinating center and data analysis center. So I think in order to maintain the quality of the data, you need that kind of structure so that, you're really comparing apples to apples when you analyze the data. At the end of the day, what you would like to avoid is having garbage in, garbage out. Just having the volume of the data without harmonization would be extremely difficult. But I agree that there is big need to actually combine data, especially if you have the ability to design studies. We have very little control if data are administrative or already collected. We just have to make sure that they are comparable and of high quality.
Thank you, Kiros. Any of our other panelists want to add your insights to this question? No? Okay. I agree with Kiros, and I think one of the beauties of where we are with the state of the field in Africa is that there's the opportunity for groups to get together and define certain variable sets or concepts within our environmental health landscape for common data elements. And if researchers were to agree to use standard similar methodologies, we could start the projects off in a way that would create much less work for data harmonization at the back end, and you'd be in a much stronger position. So our data science initiative is quite interested in this kind of work. And so thank you, Eric, for raising this as an important question. Okay, our next question comes from Duama. And this question is, environmental data like air quality are measured in every second, but most of the health outcome data is usually taken only once daily. People analyze these data by finding average air quality per day and link it to the number of outcomes recorded using statistical methods. But in doing so, a lot of information is lost because we're averaging things and we're losing the quality and the richness of the real-time data. So the question is there more rigorous statistical techniques that can be used to use all of the data and focus in on certain markers of air quality that can be measured in real time and combined with health data outcome, which is measured less often? I'll open that up to any of the panelists.
Yeah, I can try to answer that. So I think the simple answer is yes. There are techniques in order to be able to actually exploit all the available information. Health data and exposure data do not need to be measured at the same time scale. But the real question is really what is, the hypothesis that you're trying to address. I think, however you summarize data or you analyze the data should be guided by the scientific question you're trying to answer. A very simple example, even if before you go to big data, is actually what has been done on daily mortality and morbidity and air pollution studies, where you might have daily data, but exposure goes days back, but exposure could also go, even though you have daily count, you could also have hourly data. So you can actually identify, sensitive time windows, exposure time windows, depending on the hypothesis. You may have only one data late in life, but your environmental exposure could be starting from pre-birth, even during pregnancy. So if you have the data, then you can actually exploit all the exposure information starting from pregnancy all the way to old age. And we have techniques already developed in order to be able to handle that. So I think throwing away information is definitely not advisable because we have the techniques to deal with them.
Very good. And I would also say that sometimes when data are used in a particular study, when they become available to a wider scientific community, other people with different questions can utilize the data using these techniques that Kiros has referred to generate new questions or to answer different questions than perhaps the primary group of investigators thought the study was designed for, which is a very exciting opportunity. Okay, any of our panelists want to add to this topic? Okay, if not, I'll go on here from a panel member with initials TM. The air quality measure AirQA uses, such as in Kampala, is about monitoring air quality, PM 2.5, et cetera, or other forms of pollution. Is there an attempt to do similar type of monitoring on health? And if so, which types of diseases are most related to the exposures that you've presented today? Engineer, do you want to take a stab at that?
Right, yeah, I will answer that and invite my panelists to come in. So I have to say that I come into this space as a computer scientist. So much of my focus has been on, how do we get the right technology, more specifically designed for the African context to help us collect the right data that we need. But we, being in this space, I've also come to realize that it's an interdisciplinary, space. So you need people from different approaches. I know that the GeoHealth Hub are doing the health studies, and also our colleagues at the Makerere Lung Institute are, doing studies on understanding the, the variations, things like lung functions, among different segments of the population. But I know that my other panelists from the health side, perhaps in a better position also to add some comments. Thank you.
Okay, great. Karadi or Kiros, do you want to add anything to this question?
I can't because I was busy typing an answer to somebody else's question. Sorry.
No problem. I'll just repeat. The question is whether there are other type of real-time collection or methodologies to get more personalized information on health. I think maybe your work has incorporated those methods.
Yeah, so maybe, yeah, go ahead.
Yeah, go ahead, Karadi.
No, go ahead, Karadi.
Okay, well, I can just say that the wheels turn slowly, but essentially in the old days, we'd be using time activity patterns, diaries, where we'd be asking people to collect information either hourly or daily and so on. But that's definitely become easier to do now with technology. So with the likes of tablets, even not with necessarily smartphones, just basic phones, we are able to capture data in a way that's more user-friendly and is not burdensome to our participants.
Great. Kiros, do you want to add to that?
Yeah, I think there are some low-cost monitors that are becoming more available. And in fact, in the GeoHealth Hub, there is an attempt to collect personal exposure. Of course, we don't have any hope of collecting it on every one of our subjects, but we actually try to collect it on a subsample and then to try to rely on statistical methods to, spatiotemporal models to assign exposure to everyone. Of course, the time scale becomes an issue because you have high resolution of time, but the timestamp, location stamp, and use of low-cost sensors actually makes it available and possible.
Great. I'll add another example. In the COVID pandemic, there was an app created for crowdsourcing and for use very widely around the world, so people could put their daily symptoms and any exposures and behaviors that might increase their risk of exposure or mitigate their risk of exposure, to create a very, very large database to be able to analyze the patterns of the pandemic before we had very formalized research studies in different communities. And so that's an example using a cell phone, using an app, where citizens can collect data on their own health and have that data incorporated with larger other data sets that might also describe the environmental conditions in a particular region. So I think it's a very exciting time to use all these new technologies to combine both environmental science data as well as health data. All right, our next question is from John Balbus, and first he thanks all of you for wonderful presentations. Could you speak to the relative value of a centralized regional data hub for integrating different types of data, health, meteorology, air quality, et cetera, versus support of institutional capacity building and training programs for individual universities or other institutions? In other words, might there be value of combining efforts and building centralized data infrastructures for multiple types of environmental research questions?
May I go first?
Yes, absolutely.
Okay, thanks. Yeah, that's an interesting question. Having been in this space, there's obviously, huge value of having, centralized or shared data hub. But also, I've come to realize that there are quite many, issues around data sharing. So whereas I think it's a good idea to have a centralized data hub, maybe what's the approach on arriving at the centralized data hub might need to be different. One possibility is, maybe having each institution have common standards to, share and access each other's data, as opposed to aiming to pull everyone's data at one, hub. Even within the same country, you still have a lot of, data sharing issues. If you want to pull the meteorology data and the data from the, the statistics, Bureau of Statistics, transport and the others, that in itself is already difficult. So, and then when it comes to institutional capacity building, that's also very key, of course, because sometimes the data is available in these institutions, but maybe they are not accustomed to the modern approaches on how to actually make this data accessible in a computational way. So some of the data will be available in PDF, in other places to be in paper. So even building the institutional capacity on the ways on how this data can be made available, and maybe going to the extra step of, let's say, encouraging data to be made accessible in an API, what we call it, an application programming interface, that anyone can query and access the data without necessarily taking control of the entire data warehouse. Thank you.
Thanks.
Yes, if I could add a little bit to that, actually, I think, given limited resources and the vast need in terms of physical and human infrastructure, prioritization is very important. I think maybe one thing that could be done is having at least a common understanding of how data should be stored and how data should be harmonized, at least at principle level, so that everyone could follow it. But really the issue of regional or continental versus country or even institutional-based capacity building depends on your sources. Some countries actually have the ability to do it. Others may not be able to actually do it at the institutional level, so they have to pool and try to have a country level hub or even a regional level hub in order to make it possible. But I think we need both, but it's a matter of optimization.
Great. Kara, did you want to add to that, or should we move on to the next question? Okay, great. Our next question is from Christian Lumi, and actually he asks two different things, so I'll combine them both. How do you identify and analyze the impact of transboundary air pollution into local emission to have informed policy for health? And then the second, which is a more general, bigger question for data science, is how do you handle missing data in both collecting and analyzing all these sources of data that we've been speaking of? So engineer, maybe can you speak to the question of how to combine transboundary air pollution with local emissions data for policy issues?
Right, that's an interesting question. Yeah, I think it's clear that air pollution is not a specific country issue, and there are existing models that can be used to understand the effect of pollution sources that are not necessarily located in the same country. I have two postdocs who are investigating this very issue, more from the mathematical background, try to understand, given our a receptor, can we tell where the likely sources of this? And then another one is investigating the inverse of that. So given a source, how far will this affect the other potential pollution receptors? So yeah, it's an interesting question. There are some existing chemistry models, but we're also investigating this further, especially with leveraging the network that we have, see whether we can be able to infer the sources. Thank you.
Great, thanks for that. Kiros, did you want
Yeah, so I think in terms of transboundary air pollution, I think when it comes to health, actually, I think wherever it comes from, it's the impact on health that's important. But, and sometimes it's obvious, like when you're talking about coarse materials and you're close to the Sahara, or there is a dust bloom that's flowing, I think it's very, very easy to actually pinpoint it. There could be point sources. Other times it's difficult. So you need to go deeper into the problem and maybe do source apportionment, as engineer mentioned, and try to really pinpoint what the sources of the pollution are. For instance, if you take PM 2.5, there might be some obvious local sources that you identify from source apportionment. Others could be things that may not be local, but you identify them from your source apportionment, and therefore you can investigate further, right? In terms of missing data, I think it's the same big issue, even when you're dealing with finite data. With big data, the real problem and the real challenge is actually that some places have more data than others. And I think you can use, so, to the extent it's possible, you can actually use techniques in order to, impute data, but you have to be very careful whether that imputation is actually going to just muddy the picture, and therefore it doesn't give you the real picture of what the data should look like. But even more important is actually not to generalize findings to everyone when you have clear gaps in important aspects of either place or populations or subpopulations. So missingness, being truthful to the data, but at the same time trying to use the right techniques to fill in data whenever it's actually possible to do so and writing to do so.
Great, thanks. That question reminds me of a current situation in the United States where we have wildfires that are burning out of control in California, Oregon, and Washington. And just recently there were some maps shown on TV and in the newspaper showing how the air quality that's very highly affected in the West Coast was moving eastward. And they could track some of the trends of the soot and smoke from the wildfire locations to a greater geographic area. And so it's a challenging activity to correlate that with health outcomes over time, but it's certainly a very effective communication tool for people to more broadly understand the effects, both acute and widespread, for disasters or other point sources of pollution. And that leads me to a question that just came in about communication. So this is from Cyril Petit, and she thanks you for excellent talks for the session. Dr. Wright addressed the issues of communication. A key component that is understanding and communicating risk relative to hazard. Can the speakers comment on the way that risk communication and risk assessment, so many coming in at once, it's jumping around, versus hazard ID is or should be integrated into data collection and compilation efforts for environmental health in Africa? Where are the opportunities to improve this element and what are the hurdles? So communicating risk and hazard, risk assessment and hazard information. Karadi, do you want to?
Yeah, I can give it a go. Essentially, the training of researchers and the performance evaluation of researchers for always, I think, has been around academic output. So it's been around publications, conference attendances, a number of PhD graduates, and so on. It's only been in my organization for about 2 years that communicating risk, research translation, and so on have become key evaluation criteria for me as a researcher. So I think it starts there. You have a study where, for example, we were looking at acid mine drainage, and we found a community where there were extraordinarily high levels of arsenic in the drinking water of the people. So that was an observation that we made. There was an obvious risk. There was evidence of impact in the community, and your ability as a researcher to know what to do with that information is sort of impeded because you haven't really been trained in what steps to take. So I think it's about partnerships. In part, we need training, but we also need to partner with the right people to get the information to those who are at risk in the most sensitive way without causing chaos or panic, to work out how those kinds of situations can be ameliorated.
Great, thanks so much for that. Anyone else want to address that question?
I just want to add that, dissemination is extremely important, and in fact, sending the right message, not really to alarm people, but at the same time to actually send a clear signal to the public what the implications of environmental hazards are actually is extremely important. Both for policymakers, but also for the lay public. We have seen all actually how a simple sentence could be twisted and therefore sends the wrong message and completely invalidating what you have found in your scientific paper. So translation is extremely important.
Great. Well, I've been getting some cues here that we're coming up on time for our discussion. I want to thank all of the attendees for their outstanding questions, and I apologize that we were not able to reach every single one, but our speakers have seen them and perhaps madly typing answers to them as they're speaking to the rest of the group. They will be archived, and there's also the opportunity to discuss the issues that were not covered in our next activity, which is our network lounge. So let me stop here and thank our three presenters for outstanding presentations, really covering the landscape, giving us a deep dive into the challenges that we face in order to collect and utilize environmental health data on the continent of Africa in the best way possible. And I'm going to turn it back to Pulang, who's going to tell us how we can go to our network lounge for some more chit chat.
Thank you so much, Gwen. I really appreciate it. Thank you so much to the panelists, to you for moderating the panel in such an amazing way. And while we have come to the end of the webinar panel, we're not necessarily finished. You are invited, in fact, to continue the conversation by joining our interactive session, where you can engage more with each panelist and share your thoughts and hear from the panelists and ask further questions. Those can last for 30 minutes and beyond, and you can hang out in the network lounge. In order to get there, you'll move into the Kilestorm platform to find the network lounge, and I'll show you how to do that in just a moment. But first, we just want to speak to you about the exit poll. But before I do that, because there was a bit of disruption this morning with my network, I want to reintroduce the NIH consultation that you can still continue to do online. So it's right behind my screen this time. I don't have to share the screen. There's your NIH consultation times. Please take note of them, and you can get to have further consultation with the NIH. And then I also want to remind you of how to apply and visit the various hubs. So those are the dates for the 24th of November to the 8th of December for you to visit and visit the hubs. And then also we spoke about the upcoming events. They are right behind me on the screen this time. I hope you can see them. These are the upcoming events. Please take note of them and visit those events on the 30th of September, the 7th of October, 13th of October, and 14th of October, and the final one on the 21st. Please take note of those dates. And so finally, you can take a moment to just click on this link, and it will also be shared on the chat shortly. Use this link to just give us feedback about today's event. We actually use this feedback to modify future events and hear from you and respond to your comments, and that's the feedback. Please take a couple of minutes. We thank you for joining us today.